see the algorithm for the basic life support. So here we will use the theory, and in other videos we will do the practice. The first step is we see a patient that appears unconscious, so is lying on the floor. We think that is not responsive, so we see the victim, and we suspect that is non-responsive. So suspicion about this. So we go to the patient and loud says, "Sir, are you right?" or "Miss, are you right?" If it is a man, an adult, we usually hit the shoulder. We are not going to do a saccade or something like this, where we don't want to shake the patient, the victim, because maybe the patient has a cervical damage, and that would be very dangerous. So it's just, "Sir, are you right?" on the shoulders. If there is no response, then we confirm and there is no response. So now that we begin with a patient that is, or a victim that is unresponsive, lying on the floor, the first step is to call 911 for help and to get the automatic external defibrillator. If we are around people, we can say, "Sir, are you right?" We confirm that it's not alright, and then we say, "You, the one with the blue t-shirt, call 911. You, the yellow t-shirt, get the AED." Because we need help and we cannot waste time. And it's specifically important that we say, "You, the one with the blue t-shirt," because we specifically want that person that we're talking knows exactly what needs to do, and there will be no confusion between is calling me or is not, is calling that person. No, we need to act very quickly. So it's better if we are with people around. Next, just when you are taking or seeing if the patient is not responsive, you're not going to knee on the floor with 2 knees, because maybe the patient gets, the victim becomes aggressive and you can attack you, so you will just knee with one leg in order if something happens you can roll. And certainly before doing this you need to see that the situation is alright. Alright, now, after having this under control and you ask the other person to tell you that they already called 911 and what happened, etc., you will begin checking if the patient has pulse. You will not spend more than 10 seconds checking for the pulse. Now the pulse you can check it on the radial artery or you can check it on the carotid artery, but you will check it on the side of the patient that you are knee. If you are knee, this is the victim, you are knee on this side, you will check it on this carotid artery, because if you do it on this side, the people around can think that you are drowsing the patient or something like that. Alright, so not spend more than 10 seconds doing this, and you will see if there is a pulse. Now we have 2 options. Yes, we have a pulse, or no, we have no pulse. So if we have pulse, then this is just a respiratory block or a respiratory problem. So there is no need to give compression, we just need to ventilate the patient, and if it is an adult, we will give 1 respiration every 5 to 6 seconds. If it's a child, we will give it every 3 to 5 seconds. And we constantly need to check that the patient is alright and checking the pulse, but after time of doing this, because eventually if the patient here the patient has pulse but it's not ventilation, so we need to see that because of the lacking of ventilation, then the patient does not lose pulse or something like that. So this is the algorithm. Now, if the patient has no pulse, now we begin CPR. CPR is the cardiopulmonary resuscitation. Here we will do 30 compressions followed by 2 breaths. The quality of compression is 5 to 6 centimeters on depth for an adult and 1.5 inch for a child, for a baby. Sorry, a baby. The CPR, The quality is you put one hand like this, the other like this, and you begin CPR. In the adult is on the center of the chest, on the baby is you trace the line of the nipple just below that. Now remember that the compressions need to be on a surface. You need to put a table or something underneath the back of the patient, because you don't want to do it on the bed or something like that. This would be just floppy. So we need a hard surface. And remember that when you do the compression, you need to do it like this. You cannot fold the elbow. So you need to do it all this. And you will do 30 compression. You will count to 30 and then 2 breaths. When you do 2 breaths, you need to put the head like this, open the mouth, and give the breath. And then you go back. You will do 5 cycles of this. So you are doing 150 compressions alternated with the 2 breaths. And only after these 5 cycles of 30 compression and 2 breaths, you will check again the pulse. Then, so see here you do CPR, 5 cycles of 30 compressions and 2 breaths, and then you go back to here. And this is a cycle. You will check the pulse, and if you still without pulse, you continue and continue and continue until the defibrillator comes. Defibrillator arrives. So you need to end the, if you're in this, you just have done 4. Until the defibrillator comes, you continue to the 5th cycle. And then you put the defibrillator. While it is charging, you need to continue doing the compressions. Then you need to see that nobody is around. You say 1 out, that is, I'm not talking the patient, so 1 out. 2 out is the patient is not touching anybody, anything else. 3 is anybody is touching the patient, and then you check again that you're not touching the patient, and you put the defibrillator. You want it's on the left side or on the right side, and you give the discharge in case that we need the discharge, because first we're putting this, and the defibrillator will tell us if it is a shockable rate or non-shockable rate. If it is shockable rate, we will give the discharge. If it is not shockable rate, we will continue the cycles of compression. Again, 5 cycles of 30 compressions and 2 breaths, and then we will check. Now there is no need us to check the pulse, but the defibrillator will check the pulse and will tell you if you need to give a shock or you need to continue CPR. But in either case, if you shock or you don't shock, you continue the CPR. That is, you give the shock, immediately after you continue CPR for the 5 cycles. Or you don't need to shock the patient, but immediately you continue the CPR. So you just connect the defibrillator, and it will tell you. It is like reading the rhythm. It will tell you shock or not shock. If not shock, just continue again the 5 cycles, and you check again with the defibrillator. 5 cycles last like 2 minutes, because you are going to do it at a frequency of 100 compressions per minute. It's between 100 and 120, so it's approximately 2 minutes. So every 2 minutes you are checking the patient. So before getting the defibrillator, you will continue the CPR until either the victim moves, the ambulance comes, or the defibrillator arises, or other person that also knows how to do the CPR would come to be the second rescuer, and then that person will take your place in order that you can rest, because if you continue this all the time, you're going to be tired and it's not going to work. But you need to change after you have done 5 cycles of this, then 5 cycles of the other person, so you are changing every 2 minutes.